Hello friends, I'm Sonal Chandalia. I'm the Chief Nutritionist at Dr. Chandalia's Diabetes, Nutrition, Endocrine and Management Center. Today I would like to discuss with you regarding lipid profile tests. Now when you are handed a lipid profile test result, you usually have to first also go and show it to your diabetologist or to your cardiologist or to your doctor, because you need to understand and be able to get it interpreted. But I would like to add some value so that you can also understand your own test results better and you overall know what it is about and what health problem it is related to. So when we talk about doing a lipid profile test, we're talking about basically a combination of cholesterol and triglycerides, which is getting measured as the lipid components in the blood. A high quantity of these components, whether cholesterol and triglyceride in the blood, may go up and build up in the blood vessels, in the arteries, and hence you find that many times it can lead to the heart disease, atherosclerosis, because it goes and clogs the arteries. So overall, you'll have an increased risk of cardiovascular problems where it is directly related. Now, usually as healthcare providers, we will advise that the lipid panels to be done both for children as well as for adults, because even in young adults, we would like to, and even in young children, we would like to check that if there is a family history of cardiovascular disease like heart disease, heart attacks and stroke, it is detected early, an early age for the children as well as for the young adults. Now, what does a lipid profile cover? The test really covers the total cholesterol, which means the overall cholesterol in your blood. So it's a total number which has all the other subcomponents of different types of cholesterol. The first of that type is LDL cholesterol. This cholesterol, as we commonly know, it is called as the bad cholesterol, and when it goes and builds up in the blood vessels, it is the one that is causing the clogging of the arteries and increasing your risk to heart disease. The next one is a very low density of VLDL cholesterol, and sometimes even these very high levels can be showing some abnormal lipid metabolism, so we have to always also look into this. The third, which we know very well about, is HDL cholesterol, known as the good cholesterol. When the HDL cholesterols are in a good level or in the normal range, they help in retaining and maintaining the blood vessels well, and therefore they do not allow the buildup of the LDL, which is the bad cholesterol. The next component after the cholesterol component is triglycerides, which is directly related to cardiovascular disease, and essentially it is related to carbohydrate metabolism. So it is of great relevance in a person with diabetes who may also be at risk of cardiovascular disease and even certain organ inflammations like the pancreas. So I would like to emphasize on triglycerides and the HDL-LDL ratio, because this has a complete correlation between diabetes and cardiovascular disease. Hence, it is important to understand what is really covered in a lipid panel when you're getting it done. It essentially covers four components: the total cholesterol, which you can see the value of the ranges here. Then it covers the HDL cholesterol, which again you can see the desirable range, high range over here. The LDL cholesterol, which you see as what is optimal, normal and borderline. And additionally, it will cover the triglycerides, where again the ranges are very important. Now, why are these lipid tests required? It is very important to remember that if you have a family history of heart disease, stroke, then this is required to at least assess it at an early age, and also certain other risk factors which may be included, like high blood pressure, if there is a case of diabetes or pre-diabetes in the family, there's obesity or overweight, if there's a habit of smoking, if there's been a very sedentary life and lack of exercise and the diet has been very unhealthy, and if one has always faced undue stress for different situations, life reasons. So that's why it's very important to know that these may be the different risk factors that are existing in your life. Hence, it is important to include the lipid profile in the annual health checkup. The doctor may recommend it to be done once in 3 months, depending on what your profiles are. Thank you for listening in. Stay lipid happy and heart healthy.